Welcome to What the Health, Confessions of a Black Nurse, and welcome back to the show. And if you're new here, I'm so glad you're listening. We are kicking off season 2, and I could not be more excited. This whole season is about building confidence in your health. We're going to be digging into interpretation, discernment, and empowerment, learning how to understand the signals your body is sending you, figure out what they mean, and feel equipped to take the next calm, informed step.
What's up, everybody? How you feeling? How you doing? How you be? DK2 here. Delilah, it is so good to be back in the studio with you. Season 2, the people have been waiting. And I think this topic we're starting with is the perfect foundation for everything else we're going to talk about.
I completely agree. Today's episode is titled, How to Tell the Difference Between Normal Changes, Red Flags, and Just Getting Older. We've all been there. You feel a new ache, you forget a name, and that little voice in your head asks, Is this it? Is this the beginning of the end?
The dramatic internal monologue. I know it well. But that's exactly the question. How do you separate the expected, totally normal stuff from the things you should actually pay attention to without panicking?
Exactly. So today we're setting a baseline. Before we can spot what's abnormal, we have to get really clear on what normal even looks like as we age. So let's start there. What does aging even mean from a biological standpoint? The first thing to get straight is that aging is a natural process, not a disease. It's universal, but it's also incredibly variable from person to person. A lot of anxiety comes from pathologizing every little change. So our goal here is to establish what the experts consider a normal, expected baseline for the changes our bodies and minds go through over time.
Right. And a good place to start is with two different ways of thinking about age. We all know our chronological age. That's just the number of years you've been alive. It's the number on your driver's license. Simple.
But then there's your biological age. This is a much more useful concept. It's less about the calendar and more about your overall health, your physical fitness, and your mental sharpness. This is why two people who are both 55 chronologically can have vastly different health profiles and abilities. Their biological ages are different.
And that's the key, right? The what you can do parts we'll discuss, like diet and exercise, are the very things that help you lower your biological age, even as your chronological age goes up. And a lot of that comes down to what's happening at the cellular level. Our bodies are constantly repairing damage and replacing old cells. But as we get older, that process slows down. Some cells, like our skin cells, are replaced, but at a slower pace.
And other cells, like the nerve cells in our brain, don't get replaced when they die. So, over many years, this gradual loss of cells means our organs have smaller reserves. They can still do their job under normal circumstances, but they have less capacity to handle extra strain.
It's like a bank account. When you're young, you've got a huge surplus. As you age, you're making withdrawals without the same rate of deposits. For a long time, you don't notice it. But eventually, the balance gets lower.
That's a perfect analogy. The signs of aging that we see and feel are what happen when those reserves get smaller. So, now that we understand the what of aging, let's talk about how it shows up in some of the body's major systems.
Understanding the common age-related physical shifts is so crucial because it helps reduce that knee-jerk health anxiety. When you know what to expect, a new reality doesn't automatically feel like a red flag. In this section, we want to demystify the changes in our heart, bones, digestion, and more.
Let's start with the heart. What's happening is that over time, it's common for your arteries to become stiffer. This makes the heart have to work harder to pump blood through them, and the heart muscle actually changes to adapt to this increased workload. Your resting heart rate will probably stay the same, but you'll notice it doesn't rise as much during activity as it used to. These changes are what increase the risk of high blood pressure.
And what you can do about it is really the foundation of good health at any age. Number one is to move more. Aim for at least 150 minutes of physical activity a week. Then, eat a healthy diet focused on vegetables, fruits, and whole grains. And two big ones that can feel tough but have a huge payoff: managing your weight, and if you smoke, getting the help you need to quit. We know smoking is a huge factor in hardening those arteries. And finally, manage your stress and get enough sleep. The Mayo Clinic recommends 7 to 9 hours a night because sleep plays a key role in the healing and repair of your heart and blood vessels. Next up, bones, joints, and muscles. What's happening here is that bones tend to shrink in size and density with age, which weakens them and can even make you a bit shorter. At the same time, muscles tend to lose strength, endurance, and flexibility. This combination affects your coordination, stability, and balance, which is why the risk of falls increases.
And this is an area where you can be really proactive. What you can do is focus on a few key things. First, get enough calcium. Adults should aim to get at least 1,000 milligrams of calcium a day. Women age 51 and older and men 71 and older should aim to get 1,200 milligrams a day. Second, get enough vitamin D, which helps your body absorb that calcium. Adults up to age 70 should aim to get 600 international units of vitamin D a day, and those over 70 should aim for 800 IU. And just like with the heart, include physical activity in your daily routine, especially weight-bearing exercises like walking, jogging, or weight training. And avoid substance abuse, as smoking and excessive alcohol can lessen bone mass. Let's talk about digestion. What's happening is that age-related changes in the large intestine can lead to more constipation. This is often compounded by other factors like a lack of exercise, not drinking enough fluids, and a low-fiber diet.
The solutions are pretty straightforward. What you can do to prevent constipation is eat a healthy, high-fiber diet. Think fruits, vegetables, and whole grains. Stay physically active to help keep things moving. And a simple but important one: don't ignore the urge to go. Holding it in can make constipation worse. Okay, last one in our physical tour: the bladder. What's happening is that the bladder can become less elastic with age, meaning you need to urinate more often. The weakening of the bladder and pelvic floor muscles can also make it harder to empty the bladder fully or can lead to urinary incontinence.
A lot of people are embarrassed by this, but there are absolutely things you can do. What you can do to help manage it includes: go to the toilet on a regular schedule, like every hour, and then slowly try to extend the time between trips. Maintain a healthy weight and don't smoke, as both can make things worse. Do Kegel exercises to strengthen your pelvic floor muscles. Squeeze the muscles you'd use to stop passing gas for 3 seconds, relax for 3, and work up to 10 to 15 reps 3 times a day. And nobody will even know you're doing them. You can do them at a red light, in a meeting, anywhere. And finally, avoid bladder irritants like caffeine, acidic foods, and alcohol.
This tour of the body is so helpful. It normalizes these experiences. But the physical changes are only half the story. The changes that happen in our minds are often the ones that cause the most fear. So let's talk about that next.
This topic is one of the most important ones we'll cover because memory concerns are a huge source of anxiety around aging. The fear of losing our minds, of developing dementia, is profound. Our goal here is to bring some clarity and perspective to help you understand the spectrum from typical, everyday forgetfulness to symptoms that might warrant a conversation with your doctor.
Right? Because not all memory loss is the same. The Alzheimer's Society of Canada breaks it down into three general levels. The first is age associated memory impairment. This is considered a normal part of aging. This is when you occasionally forget the name of an acquaintance or you can't remember where you put your keys, but you find them later. It doesn't disrupt your daily life.
In the middle, there's a condition called mild cognitive impairment, or MCI. Here, the memory loss and other symptoms are more noticeable, but they're still mild enough that they don't seriously interfere with your normal daily functions. However, people with MCI are at a higher risk of developing dementia, so it's a state of something to watch.
And then there's dementia. This is when memory loss becomes severe enough that it really affects your daily life and your ability to stick to a routine. You find it difficult to learn new things or complete familiar tasks. It's a significant departure from your previous ability.
So, to recap, normal is occasional and doesn't disrupt your life. MCI is noticeable but still manageable, and dementia is when it starts to seriously interfere with daily function. That's the simplest way to think about it. Delilah, let's make this even more concrete. I'm going to describe a sign of normal aging, and DK, you contrast it with a more troublesome sign that might suggest something more serious is going on. Let's start with memory. A normal age-related change is occasionally misplacing things or forgetting names and remembering them later.
The more troublesome version of that would be forgetting recent events, like what you ate for lunch, and struggling to recall familiar faces or places more frequently.
And that's a really key difference. Forgetting something recent versus something from a long time ago. That distinction matters. Okay, how about language? A normal sign is occasionally having difficulty finding the right word, that tip of my tongue feeling.
A more troublesome sign is having frequent pauses and substitutions when trying to find words. It's a struggle to follow or take part in conversations. And you might find yourself repeating the same phrases or stories.
Let's do personality. It's considered normal for your personality to shift a little bit as you face life's challenges.
The red flag version is drastic shifts in personality. We expect people to stay generally consistent. But if an extrovert becomes a total introvert, or if there are sudden mood swings, irritability, or uncharacteristic behaviors, that's something to know.
Last one, awareness. In normal aging, you generally notice the changes in yourself and find ways to adapt to them. You're aware of your own memory lapses.
The more concerning sign is when you're not very aware of your own decline. Other people, your friends and relatives, are worried about your memory, but you may deny that there are any problems at all.
Thank you, DK. That comparison is so clarifying. The key takeaway here is that while some cognitive slowing is normal, the differentiator is when the changes start to significantly disrupt your ability to function in your daily life.
So we've talked about what the physical and cognitive changes, but now let's touch on the why. There's a key scientific concept that helps explain the underlying driver of many age-related changes, and it's called inflammaging. It's a term that combines inflammation and aging.
In simple terms, inflammaging is the chronic, low-grade inflammation that develops as we get older, even without an obvious infection or injury. As we age, our immune system gets remodeled. The innate immune system, our body's first line of defense, can become overactive and less precise. This results in a constant, low-level pro-inflammatory state throughout the body.
And researchers have identified a couple of key causes for this. The first has to do with something called senescent cells. As our cells age, some of them stop dividing, but don't die. They can stick around and release what's described as a pro-inflammatory cocktail of chemicals, which contributes to this systemic inflammation. The second major cause is a decline in autophagy. This is essentially the body's cellular housekeeping or recycling program. It cleans out damaged components inside our cells. As we get older, this process becomes less efficient, and when those damaged parts accumulate, they can trigger an inflammatory response.
Exactly. And this creates a powerful aha moment for our listeners. So when we talked earlier about a healthy diet for your heart or managing stress, this is why it works on a deeper level. Those actions are actively calming the chronic inflammation that drives so many of these changes. Understanding this concept isn't about being an immunologist. It's about recognizing the link between the science and what we can actually do about it.
Okay, we've covered a lot of ground: the biology, the physical changes, the cognitive signs. Now we want to give our listeners a tangible tool to apply all of this information in their own lives. This is a practical framework inspired by a reflection guide we found that helps you assess a change you've noticed calmly and systematically without jumping to conclusions.
The first step is step 1. Name the change without judgment. Simply state what you've noticed. For example, I'm feeling more tired in the afternoons, or my joint stiffness in the morning lasts longer than it used to. No fear, no story, just the observation.
Then, step 2, put it on a timeline. Ask yourself, how long has this been happening? Days, weeks, or months? And compared to when you first noticed it, is it about the same, getting better, or gradually getting worse? This helps you gauge progression. Next is step 3. Check the impact on daily life. This is critical because it helps separate a minor annoyance from a genuinely disruptive issue. Does the change interfere with your work? Does it affect your sleep? Does it limit activities you normally enjoy? This step puts the change into context.
And here's an important one that often gets missed. Step 4, look for patterns. This isn't about finding an answer, but about connecting the dots. Does this change show up more on busy or stressful days? Does it improve with rest? Does it seem connected to sleep, meals, or schedule changes? Noticing these patterns provides valuable context. After that, we have step 5, gentle categorization. Based on everything you've just reflected on, you make a provisional assessment. This is not a diagnosis. You simply ask, right now, does this feel like likely a normal change, something to watch over time, or something worth discussing with a healthcare provider? Delilah, this whole process is so valuable because it's about gathering information, not jumping to an answer. And the reflection guide includes some really important reminders that are worth repeating as key takeaways. Common does not always mean normal. Noticing is not overreacting. And my favorite, You do not need a diagnosis to justify attention.
That last one is powerful. Using a calm, structured approach like this replaces anxiety with awareness. It empowers you to be an informed observer of your own health, which is the first step to becoming a better advocate for yourself.
So, to bring it all together, the journey of aging involves a wide range of changes, and most of them are a normal, expected part of life. The key is learning to distinguish between gradual, manageable shifts and those that are progressive, disruptive, and significantly impact your ability to live your daily life. One is a process to adapt to, the other is a signal to act on.
Absolutely. And to leave our listeners with some clear guidance, here are 3 actionable, calm next steps you can take to support healthy aging. First, stay active. This came up in every single source. That means physically active with weight bearing and cardiovascular exercise, mentally active by learning new things and challenging your brain, and socially active by staying connected to your community. Second, prioritize a healthy lifestyle. This is your foundation, a diet rich in fruits, vegetables, and whole grains, getting 7, 9 hours of quality sleep, and actively managing your stress levels. These aren't just suggestions, they are powerful tools for managing the aging process. Third, communicate with your provider. Use the framework we just discussed to gather your observation. Go to your appointments with information about what you've noticed, how long it's been happening, and how it's affecting your life. Remember, noticing is not overreacting, and you do not need a diagnosis to justify attention. You're bringing observations, not a self diagnosis, which makes for a much more productive and empowering conversation. Absolutely. And to leave our listeners with some clear guidance, here are 3 actionable, calm next steps you can take to support healthy aging.
That is the perfect summary. Thank you for that, DK. And thank you to all of you for listening to our season premiere. We hope this conversation gives you a new sense of perspective and calm. Join us next time for episode 2, When to Watch, When to Wait, and When to Act, a smarter way to respond to body changes.
It's going to be a good one. Stay healthy, everyone.
Thank you for taking the time to listen today. If this episode helped you think differently about your health, please share it, rate it, comment, and make sure you're subscribed. It's free, and it truly helps this podcast reach more people. Next week, we're shifting into something big: symptoms versus signals, and why discomfort doesn't always mean something is wrong. Because your body isn't broken, it's communicating. Stay healthy and be well. This podcast is for educational and entertainment purposes only. It does not provide medical advice, diagnosis, or treatment. Listening does not establish a provider-patient relationship. Always consult your personal healthcare provider regarding your health decisions.